Welcome to the Spark Standards in Action Showcase, where active Spark community implementers share their perspectives, experiences, and example implementations of some of the FIRE implementation guides designed by the Spark community. Here we will have community representatives showing the art of what's possible using the community design specifications to enable safer, more connected, and more efficient healthcare. I'm your host, Michael Hosking, Deputy Lead for Community and Engagement for Sparked. For this showcase, we'll jump straight into the discussion. For a background on Sparked, what it is, our goals, and related resources, please visit sparked.csiro.au. We're joined by Sean Walker from Alcidion. Sean is the CTO at Alcidion, leading technology, strategy, and cloud operations across Australia, New Zealand, and the UK. With over 25 years in digital health, he's been central to the development of the Maya Precision Fire platform since its inception. Thanks for joining us and for sharing your experience, and also a demo we're excited to see.
Thank you very much. It's wonderful to be here with you today.
Great. So, Sean, what are your current challenges of health information sharing in Australia from Alcidion's perspective?
Sure. Well, I think perhaps I might just give some background or some context about Alcidion to put that in context. So Alcidion provides a range of clinician-oriented solutions to improve clinician decision-making, patient flow, and ultimately care outcomes. To achieve these objectives, access to data is crucial. And as you mentioned earlier, Michael, we've invested heavily in our FHIR-based precision platform, which is a two-way messaging platform that integrates and aggregates data and maps it into FHIR before it comes into the platform to trigger events and alerts to assist clinicians. So we've had to do a lot of work up front to map and transform that healthcare data that's locked away in proprietary databases or legacy applications that weren't built with sharing in mind. And in fact, I would say today we're still about 95% of our integrations we build don't have any involvement with FHIR. So we have to do a lot of transformation work. There's a lot of investigation work that needs to be done up front to map data, to ensure that it is stored correctly within the platform where it's stored natively in FHIR. So luckily for customers, once they've implemented it, their consumers can start leveraging a FHIR API to access that data. But that's a key challenge that exists today in the majority of the locations that we implement.
Yeah, there's a lot of challenges in terms of all those legacy concepts around standards and infrastructure, and also dealing with some of the, I guess, hangover from a lot of the past standards that exist. And Sean, what problem do you see Spark solving?
So Sparked really, in my mind, is solving a couple of problems. One of the main thing it's doing is creating awareness of the FHIR standard and its use within Australia, pulling together vendors and people in the community to ensure that FHIR becomes something that is utilized throughout the industry in Australia. And secondarily, by creating those Australian-based standards that are specific to Australia so that we can have seamless data transfer between platforms and reducing inconsistencies of data mapping. This reduces the cost of implementation for healthcare organizations and will ultimately result in increased safety for patients.
Absolutely. I think the cost is a really big one that people might not be aware of, and that also increases the benchmark of the capability of services for the industry to provide. So I think that's a really good one to raise. And I guess, why is Alcidion involved in Sparked?
Well, I might just riff a little bit more first, if you don't mind, Michael, on the cost one. That is, it can't be underestimated, right? There's so many organizations that are holding on to legacy systems because you might have a purchase cost of a piece of software, but the implementation cost just makes it so it's very difficult to do. So as we move towards this, it's really going to improve the ecosystem. Sorry, back to your last
No, no,
question.
that's fantastic. I appreciate the elaboration. I think that cost is a good one to encourage people to get more involved.
Mm.
And in terms of Alcidion's participation, why is Alcidion involved?
Yeah, so why is Alcidion involved in Sparked? Well, as I mentioned, we were perhaps a bit ahead of the curve. We adopted Fire back in 2016, and we had our first implementation of Precision back in 2018, which was likely the first Fire events-based platform in the world. And well, definitely in Australia, possibly the world. I don't know. We didn't know of any at the time that were sort of doing that. And it was really, I guess, somewhat disappointing as we went out to realize how little fire was being used in the regions that we interact in, which are ANZ and the UK at the moment. And so having a community like Sparked and being involved in a community like Sparked to help drive the transformation of data interoperability in the health industry is so important. And having the ability to guide that standard adoption in Australia is also quite important. We've had to, along the way, make a number of extensions and things that we've had to do because it just wasn't there maybe in the standard, or it just didn't fit the Australian context. Another thing is the Sparked initiative provides a great testing framework that we can work with, right, to provide assurance to other vendors, to provide assurance to organizations that might purchase us and want to be assured that we meet the Australian standards. So that testing framework really helps us and helps provide assurance.
Absolutely. I think it's also helpful that your participation and others' participation informs the standards that are fit for purpose for the country and then therefore fit for purpose for the broader digital health ecosystem. Um, and I guess in terms of the fire implementation guides that Sparked community has created or are creating, which ones are you implementing?
So we've implemented AU Core, and luckily on our first round of testing for that we ever did, we were 95% compatible in our first attempts. We were pretty pleased with that. We've also implemented the international patient summary, and then segued from that into the Australian patient summary. And I think those are great initiatives to enable just simple sharing of that patient data. That's so important to just give that brief overview of what's been going on. So we've also done a couple of other things which were based on AU Base 2 and Fire R4, and that was specifically for the Australian Defence Force Health Knowledge Management Program, where we created a Maya Precision implementation guide, as I mentioned, based off of AU Base 2 and R4. And that implementation guide is used to support our Fire messaging that we use between different vendors, as well as the API.
Right. Well, it's fantastic to hear all that work that you've been doing. It'd be good to see it in action. Are you able to share a demo with us?
Fantastic. Let's go for it.
Perfect. Let's go.
What we are showing on screen is the Alcidion Maya Precision patient record that we have loaded with the Sparked AU Core test dataset. We have designed this view to give a rapid overview of all the important clinical patient information available. On screen now is the patient demographics, with important information displayed at the top in the patient banner. This next tab is showing details of their current patient visit and would also show any previous visits if they were available. This patient was admitted to emergency just over 5 hours ago. This is a list of all the allergies and tolerances on the patient record, with icons displaying the type and any other important information like onset. All of these details can be updated easily in the edit pop-up. Next, this patient has received a multiple biochemistry result. This diagnostic report was not included in the SPARCT-AU dataset and has instead come from our own synthetic data generator. Maya is highlighting any values that are outside the normal ranges. This tab is showing the list of current and past patient medications, in this case a previously prescribed antibiotic. Finally, this is the list of active and past problems, and the displayed chronic kidney disease is also from the SPARCT-AU test dataset. I have now switched to our view of the Australian patient summary generated from the test patient's record. As you can see, all of the relevant information is summarized in this view. This patient summary conforms to the latest AU patient summary profile and is being rendered directly from the generated FHIR bundle. We support exporting the patient summary in multiple formats, including JSON, PDF, and HTML.
Thanks, Sean, for sharing that demo. That was really fantastic to see the opportunities and potential for health information sharing across the board and what it means for the future in terms of being able to enable new and better workflows for health information across the ecosystem. So that's great. Thank you very much. Now, I guess I'm keen to know a little bit more about why others should get involved in Spark. What would you suggest to them?
Sure. So a couple things. First, I think it's, your viewers that are watching, I'm hoping they understand already what FHIR is, right? They're already educated about that, but it's really about, as you mentioned a little bit into your segue there, about improving that data interoperability in healthcare and reducing costs. And as you're part of Spark, you're upskilling your team to adopt the use of FHIR. There will be an expectation coming forward that vendors operating in Australia do meet the Australian FHIR standards, right? And that is coming. Already that's the case. So if you're a vendor that wants to operate in the United States, you have to have a FHIR API, right? So that's even a side benefit of if you ever want to go over to the States and you're an Australian vendor, well, you get a good kickstart from Spark moving you along that path. So there's a number of really great reasons to be involved in the Sparked effort.
Great. No, thanks for sharing that. And in terms of one key insight that you'd share for adopting national FHIR standards, what would you share there?
In terms of adopting the standards, I'm going to speak to you as a vendor. So as a vendor, get involved in Sparked, go to the community events, meet other vendors and other people involved in this. It's a great community, and the tooling and the support is really fantastic.
Yeah, and I think it's also fantastic to see your contributions to the connectathons to make sure that your products are adhering to or able to test the standard to make sure it's fit for purpose, and likewise that the standard suits the existing ecosystem with minimal effort for what we want to achieve.
Absolutely.
And just wanted to say a big thank you for your time for this session, but also the investment into contributing to the national FHIR standards themselves as part of Spark. We couldn't do this without you. So for those watching at home, if you're interested in participating in Spark, we've included a QR code that will take you directly through to registering. And also, please feel free to jump on the website to explore and have a poke around. We also have a Spark podcast, would you believe? Season 1's out at the moment, and we're currently working on season 2. And we share a lot of information and updates on LinkedIn, so give us a follow as well. And then lastly, if you have any questions, you can email us at sparked@csiro.au. Thanks very much, Sean, for your time. Appreciate it.
Thank you very much.